Brewitt, and I am the Executive Director for the Council for Children and Adolescents with Chronic Health Conditions. On behalf of the Partnership to Fight Chronic Disease in the Council, I thank you all for joining me and my fellow concerned advocates and citizens on this very momentous day in New Hampshire. All over our state and throughout the country, we are faced with an ever-growing chronic disease epidemic, which in years past was not afforded the recognition it so rightly deserves. It is the goal of the Council and the Partnership to Fight Chronic Disease to highlight these issues, to encourage cooperative dialogue between our government leaders, and to offer every New Hampshire citizen effective resources to improve the health of friends, family, and most importantly, our children. Today we are here to express our heartfelt gratitude to Governor Lynch for his dedication to the fight against chronic disease, a central issue here in New Hampshire. With Governor Lynch proclaiming May 25th through May 31st as Chronic Disease Awareness Week, we have a tremendous opportunity to raise awareness about the human and financial cost of chronic disease in every corner of the state, to every family, to every business, and to the policy makers who play an essential role in finding solutions to this complex problem. 2 out of every 5 adults are presently affected by a chronic disease such as heart disease, asthma, cancer, and diabetes. Many of these conditions can be managed by adults through early detection, improved diet, exercise, and treatment. Unfortunately, chronic disease is becoming just as common among children. 1 in 6 New Hampshire children contends with a chronic health condition. These children and their families face numerous challenges, including education issues, medical concerns, and family support needs as a result of their health conditions. Studies from the Partnership to estimate that chronic disease costs New Hampshire citizens over $3 billion every year. In addition, over $300 million is spent every year on obesity-related expenditures. That's why it is so important for us as adults to show our children how to live healthier lives. And we can do that by adopting healthier lifestyles ourselves. I do not stand today before you simply as an advocate of a worthy cause, but also as a mother of 3 wonderful children. Our youngest son, Ryan, came into this world with a rare chronic health condition. He is 1 of 10 diagnosed cases in the world, and his treatment has been based on the research of his dedicated team of physicians. We have been fortunate to bring a great quality of life to Ryan by taking proactive steps in treating his illness. Through family-centered community supports, Ryan, who had once lost his mobility, is now able to live a normal, active life. And although there is no cure, we have reached a stage of remission. Yet there are thousands of children and adults with chronic disease in our state who aren't as lucky as Ryan. They don't have access to the screening or the treatment that they need. All policymakers, regardless of party affiliation, and healthcare providers and advocates alike must collaborate and educate and service the needs of these at-risk citizens. Today we mark the start of this collaborative process with the presence of Governor Lynch, Senator Jack Barnes, Senator Maggie Hassan, and Representative Lori Harding, and the numerous other legislators and staff, both parties, who have joined us today. I thank you all for recognizing Chronic Disease Awareness Week and ask that you take the energy from this occasion and make addressing chronic disease issues a priority. If we don't address chronic disease for our children, who will? Let us all foster change today so that our children will have a better tomorrow.